Our next session is on accelerating the control of malaria through research partnerships, and this will be led by Dr. Maria Ome-Kaius, who is a senior research clinician.
Thank you, MC, and hello everyone. My name is Maria Ome-Kaius, and I am a senior research clinician in the Vector-Borne Disease Unit, which is led by Dr. Moses Laman. Vector-Borne Disease Unit will be leading this session, which is about accelerating the control of malaria through research partnerships. Malaria has been a major research focus for PNGIMR for over 45 years. Through the years, the Institute had collaborated with many partners from both within PNG and from abroad who continue to collaborate with the Institute in malaria research. Research into malaria and other mosquito-borne diseases such as lymphatic filariasis and arboviruses are primarily conducted by the Vector-Borne Disease Unit. Vector-Borne Disease Unit is perhaps the biggest research unit in IMR, comprising almost half of the Institute's workforce. Up to 80% of this workforce are employed on research project grants, the grants that are jointly won by researchers from IMR and from partner institutions. Vector-Borne Disease Unit has strong technical expertise in epidemiology, clinical trials, microscopy, entomology, molecular diagnostics, and immunology. And in this 25-minute session, we hope to showcase some of these core functions of the Vector-Borne Disease Unit in malaria research and the partnerships that allow the research programs to generate new knowledge and evidence to improve their health outcomes, both in PNG and globally. Let's now move to our first presentation.
This presentation will be focused on using a partnership-based approach in implementation research with support from a coordinating project management unit. This is the outline of the presentation. The first part will be led by Mr. Leo Makita, and he will focus on the partnership approach of the project and its guiding principles, and I will lead the second part and focus more on the role of the project management unit.
Different settings have different definition of partnerships. What we use under Strive and Trilateral is focused on genuine partnership where everyone contributes from their place of strength and every partner feels valued. This slide reflects the partnership continuum. One extreme reflects a partnership governed by money, while the other extreme is focused on co-created activities and everyone's involvement. This is not to say that one is better than the other. It highlights different perspectives. Having defined the kind of partnership that we utilize under Strive, Trilateral, and other projects under Vector-Borne Disease Unit, you may ask, how do we do this? This approach is guided by what we call guiding principles. As reflected on this slide, these principles guide how partners behave. They would include building common purpose along a shared journey, promoting mutual benefit through knowledge of vulnerability as well as strengths, promoting equity and voice across within partners, and promoting ownership and sustainability within PNG institutions, harnessing diversity across partners, promoting transparency, fostering equity, and finally flexibility and adaptness.
Partners feel valued when we identify their strengths and utilize their strengths. The analogy of this car summarizes what we mean by this. Different partners bring experience, skill set, status, cultural influence, expertise, settings, etc. All this adds value to the project and ensures and guides how the project moves forward. To ensure that all aspects of the project function in a coordinated manner, the Project Management Unit is the coordinating body of the project. They ensure that project operations are always ongoing. The governance structure of the project provides guidance on how Project Management Unit operates. There are different groups that the PMU or Project Management Unit engage with for different things, starting from decision making to implementation of the activities. Thank you.
Hi everyone, my name is Henson Dima and I work as a project laboratory manager with the Papua New Guinea Institute of Medical Research attached with the vector-borne disease unit for the last 10 years. I will be speaking about the challenges faced out in the field and how our work on malaria research over the years and the partnership established with the communities around Papua New Guinea are utilized to overcome those challenges. As we know, research is very important for evidence-informed decision-making and policy change. Our work on malaria research to support evidence-informed decision and the fight against malaria has taken us out into some of the remotest part of Papua New Guinea, where basic healthcare and other vital services are of serious concern. Reaching out and helping to provide basic healthcare and malaria treatment are often very challenging. In this short presentation, I will highlight some of these challenges faced and how partnership formed over years with communities, health facilities, and other stakeholders play a key role in overcoming those challenges. Now, the challenges, I have grouped them into four groups. Operational challenges, staff. In Papua New Guinea, when you employ someone, we say you employ a whole community, meaning the staff carries the burden of the community to work, and this can affect their performance. For instance, if there is a death in the community, it is his or her cultural obligation to be there to support the family or community. Thus, this can affect his availability at workplace. Power outage, transportation issue, communication are also common operational challenges faced on a daily basis. Community engagement, low literacy level. As we are aware, much of Papua New Guinea's rural populations have education up till primary level, or some do not at all, which can be very challenging when communicating the research purpose and methods. This can lead to misconception about IMR's work and thus develop unwanted expectations beyond our capacity to control. Unexpected movements and relocation of participants. Papua New Guineans are very mobile. They can get up one morning and decide to relocate to a different community, district, or province for days, weeks, or even years. That makes it very challenging, especially for follow-up and data collection. And logistical challenges, poor infrastructure development, bad road and bridges associated with uncertain weather conditions such as heavy rain and flood can be of problem when reaching out into rural communities. Most communities are not connected by road and are only reachable by foot or boat. This presents very challenging conditions for research work. Traffic issue is also a common issue when traveling frequently out to reach out to the community. Law and order issues such as alcohol and drug abuse, petty crimes such as hold-ups and community fights are also common problems faced out in the field that can hinder the operation or progress of your project. The lesson learned is that fieldwork strengthens an expertise. Unexpected changes and challenges occur which may demand immediate decision and action based on local knowledge and experience. Having worked for over 45 years on malaria research, PNGIMR has this network and a connection to address those challenges. This enables PNGIMR and its partners to conduct research collectively in partnership with communities to improve the health, especially for those participating communities and PNG at large. Now, the importance of partnership, long trusted relationships. With our long-standing work across PNG, we have established relationships and trusted networks within communities that enable us and our partners to carry out successful malaria research and data collection that provides a platform for informed decision-making at different levels of health. Whilst in the process of conducting research, we are also able to work with our partners and communities to try to assist with the much needed healthcare needs for the community. Local knowledge and experiences. The experience and knowledge we gain from the partnership about the different challenges is shared among the community and different stakeholders to strengthen and successfully carry out the work of malaria research and also better prepare us and our partners and the community of the new project work that is coming into the communities. Thank you very much.
Hello, my name is Tamarah Koleala, and I am a scientific officer with the Vector-Borne Diseases Unit based in Port Moresby. I will be sharing with you the laboratory capacity we have across our sites for our vector-borne diseases projects, particularly for malaria. PNGIMR's vector-borne diseases laboratories are set up across 3 provinces. We have laboratory work established in Medellin, Port Moresby, and Maprik in the East Sepik province. Maprik is a small site that has coordinated many studies that have contributed to local and global policy changes for vector-borne illnesses. The laboratory capacity of Maprik comprises of a microscopy unit and a specimen preparation laboratory. Malaria, lymphatic filariasis, and soil-transmitted helminth infections have been studied with techniques like the CATO-CATs for helminth infections established in Maprik. The Medellin site is located within the Yagaum Rural Hospital facility. We have laboratories spread out across the site, as you can see on the slide. Our microscopy unit has skilled level 1 microscopists. Our entomology team is the largest on site, and we have the entomology lab and field teams working on projects that focus on understanding wild and lab-bred mosquitoes and how they spread vector-borne diseases. Our immunology lab looks into understanding how we respond to malaria, and our molecular parasitology laboratory focuses on understanding these diseases and causes through genomics. Our partnership in health laboratory in Port Moresby has facilities that can support immunology, molecular, and diagnostic studies for multiple infectious diseases. We are based in UPNG's School of Medicine and Health Sciences, Tarama campus. This lab is part of the PNG Molecular Hub, which includes partners from UPNG, the Central Public Health Laboratory, and NACIA. We have pooled our resources for molecular testing, which enabled the facilities to support diagnostic testing for the recent emergencies of COVID and more recently, African swine fever. The PNG Molecular Hub supported PNG's COVID-19 response through both molecular diagnosis and serosurveillance for samples collected from all provinces across PNG. Prior to alternate molecular assays becoming available, like the Gene Expert, the hub supported the response through running almost 10,000 PCRs. Support from project partners in our malaria projects were very helpful in enabling us to support this response. Our Port Moresby and Medellin sites have the capacity to do molecular testing through real-time and conventional PCR. For serology work, we have established ELISA setups in both our sites. We also have the MagPix device, which allows us to study antibody responses to multiple antigens. Our Medellin laboratory has been involved in research and development activities through field evaluation studies of prototype devices. An example is this rotating magneto-optical device, where it basically uses magnets and lasers to detect malaria using the magnetic properties. Our laboratory capacity has enabled us to be involved in various projects over decades. These are some of our current projects. All of our projects involve partners from universities and institutes, both here and abroad. The ICIMR project comprises of a global network of independent research centers in malaria endemic settings, which were established to provide the knowledge, tools, and evidence-based strategies that's crucial to understanding, controlling, and ultimately preventing malaria. It has been ongoing for almost 10 years now. The Trilateral Malaria Project was established through a trilateral agreement between the governments of PNG, Australia, and China, and aims to improve malaria diagnosis through partnerships of all responsible organizations in PNG with support from abroad in China and Australia. The STRIVE PNG project carries out integrated febrile illness, molecular, and vector surveillance at 8 sentinel sites across PNG. The Trilateral Malaria Project and the STRIVE project also support medical sciences students through research projects. Our other projects look into various aspects of malaria, from drug studies, epidemiological studies, and molecular diagnosis of malaria and other viruses. We also use our facilities to support monitoring and evaluation for the National Department of Health programs like the Mass Drug Administration and the Malaria Control Program. We hope to become a center of excellence in the region, expanding into the space of neglected tropical diseases. We are planning to improve facilities to support genomics, particularly sequencing in country, to inform public health programs. All of this is possible through partnerships. We value the relationships through international and domestic partnerships that have supported capacity building for local researchers and our facilities. Despite the challenges, it remains possible to collaboratively conduct highly relevant research studies in Papua New Guinea. Thank you.
Hi, I'm Lincoln Timinao, currently a senior scientific officer based at the PNGIMR Meding branch, and I will be providing an overview of the ongoing work at the entomology laboratory here in Medang. The Ento Lab comprises of the largest team under the vector-borne disease unit, and we have currently 28 staffs working at the entomology lab, and our work involves both the lab and the field. Now in the lab we have an insectary, which is the only one in the country, where we rear Anopheles faraudi mosquitoes, a common malaria vector in PNG, with the capacity to produce over 3,000 female mosquitoes per week. Now these mosquitoes have been colonized for over 50 years and are quite susceptible to any form of insecticides. Hence, we have been using these mosquitoes to test the bioefficacy of long-lasting insecticidal nets using the WHO cone bioassay. We have also been quite successful in infecting these colony mosquitoes with Plasmodium vivax, which makes us one of the few labs in the world that can actually do this, because it is quite difficult to grow Plasmodium vivax in the lab. Hence, we need access to infected individuals. Now, this puts us in a very unique position where we can be able to collaborate with other institutions to test potential transmission blocking vaccines or antimalarials that can inhibit transmission. We also have staff who are experts in performing the WHO bottle assay and the WHO tube assay with wild-caught mosquitoes. And we also have an ELISA machine that we use to detect sporozoites in our field-caught mosquitoes, and also PCR machines to confirm the morphological ID of our mosquitoes that are caught in the field. Now, as part of our research into understanding the biting patterns of malaria vectors, we collect mosquitoes overnight using the human landing catch method and the barrier screens. We also do larval collections to understand the ecology of the mosquitoes. And we have staff who are experts in performing morphological IDs out in the field or when the mosquitoes are brought back into the lab. Now, apart from focusing on malaria vectors, we also look at other vectors such as the vectors for arboviruses, where we are currently setting up traps for. Now, because of our laboratory setup and the type of work that we can do, we have been able to collaborate successfully both locally as well as internationally to carry out research over the last 2 decades, not only into malaria vectors but other vectors as well. Now, here is a list of some of our ongoing studies. Now, the ISEMA and the STRIVE PNG have been discussed by Tamarah. And now the ACIAR ZEPA is essentially a collaboration between the Australian Centre for International Agriculture's Research Zoonotic Arbovirus Project and PNGIMR with NACIA as well. And the main aim here is to establish environmental surveillance of vertebrate hosts and mosquito vectors of zoonotic arboviruses as well. Now, the DOLPH project is a global effort to eliminate onchocerciasis and lymphatic filariasis using the triple drug regimen. Now, the triple drug regimen is currently being rolled out in East New Britain, and we are assisting with providing the xeno monitoring. Now, the Lihir Island Malaria Elimination Project is an initiative of the Newcrest Mining, which is based on the island, and it is aimed at ridding the island of malaria, and we provide a vectoral surveillance support. We are also involved in a countrywide insecticide resistant monitoring for the National Malaria Control Program. Now, the 2 other new projects that we are currently involved in, the NatNat and the Taunam, will be further discussed by Maria. I would like to highlight here one of our work where we partnered with the Rotarians Against Malaria and the National Malaria Control Program that led to an immediate change. Now, in this study, we noted that LLINs distributed after 2012 did not meet the WHO criteria according to the WHO cone bioassay. Now, this resulted in an immediate change in the LLIN procurement strategy in PNG. And now PNGIMR is at the helm of monitoring the new nets that are being distributed. Now, this work wouldn't have been possible without the help and support of not only the Rotarians Against Malaria and the National Malaria Control Program, but the Department of Health, the University of Liverpool for performing the confirmatory tests on the nets, and James Cook University. Thank you.
Thank you, Lincoln, and hi again, everyone. As you have now learned from my colleagues, malaria research conducted at IMR by the Vector-Borne Disease Unit is always a collective effort from various individuals, institutions, and countries, and that collaborative approach to research can be mutually beneficial and maximizes impact. Working collaboratively is particularly important in a country like PNG, where resources are limited. As highlighted earlier, through partnerships, partners can participate in joint decision-making, they can pool and share resources, and can maximize impact of evidence in influencing policy. For instance, IMR has been monitoring and evaluating the impact of the National Malaria Control Program interventions for the past 10 years, providing updated evidence that can guide malaria control programs. Through the international partnerships, Vector-Borne Disease Unit is able to source assistance, resources, and expertise that we may lack here in PNG. Such partnerships have also been instrumental in building and setting up infrastructure and equipment to allow IMR to undertake high-quality malaria research that can inform malaria and health-related policies here in PNG and elsewhere. Capacity building has always been a priority at PNGIMR, and these partnerships provide opportunities for training. Included here on the slide are faces of some of the individuals who have graduated or are currently in training for Masters and PhD, and many more have done their honors. IMR not only builds capacity within the institute, but through partnership also contributes to the capacity building in the partner institutions. This is just one example of such partnerships. Here, the students from the School of Medicine and Health Sciences use IMR laboratory capacity to generate data that is needed for their different projects. Through that, IMR provides training in laboratory and research methodologies, as well as provide mentoring and supervision. Overall, PNGIMR strives to undertake innovative, high-quality research programs that are relevant and aligned to the country's health needs and those that can have significant impact on the health of the people of the country. Before I finish, I want to introduce a few of the program of work that Vector-Borne Disease Unit at IMR will be leading in the coming months to years, with a focus on evidence to inform policy. NATNAT, which stands for Newly Adopted Tools Network Against Mosquito-Borne Disease Transmission, is a large project that will be conducted by IMR and various partners as shown on this slide. Currently, long-lasting insecticide-treated nets are the only vector control tools that are programmatically implemented against malaria in PNG. Vector biology such as the early and outdoor mosquito biting and the mosquito's preference for a variety of habitats are indications for the need of additional vector control tools. But again, there is the lack of infrastructure. This work will therefore establish the capacity at PNGIMR to test the additional vector control tools, including indoor residue spraying, larva source management, and spatial repellents. The core objectives of this project is to strengthen the capacity to test these new vector control tools in PNG, conduct evaluations of these tools, investigate acceptability and cost effectiveness of these tools, and finally to support a national malaria control program-led formal network for vector control tools and interventions in PNG. If these tools are found to efficiently reduce malaria transmission, they could be integrated into the National Malaria Control Program. The second program of work is PAVE, or Partnership in Vivax Elimination, which will be conducted by PNGIMR and many other partners as shown on this slide. P-Vivax poses a major challenge to malaria control efforts. Its unique biological ability to lie dormant in the liver cells as hypnozoids allows it to escape detection and treatment. These hypnozoids then become the source of relapsing infections, which can go on to cause illness, death, and obviously sustained transmission. Radical cure of P-Vivax can be achieved by anti-hypnozoids like primaquine. The challenge with primaquine treatment is that it causes hemolysis in individuals who are deficient for glucose-6 dehydrogenase enzyme. G6PD testing therefore needs to be done prior to prescribing primaquine. To minimize risk of hemolysis, primaquine is often given at the low doses over a prolonged period of time, but the challenge with that is the poor treatment adherence. In PNG, effective control of P-Vivax has been hindered by a lack of G6PD testing and effective primaquine treatment. So in this work, a revised case management strategy for patients with symptomatic P-Vivax malaria who present to health facilities will be implemented. The key questions will be around the operational feasibility and the cost effectiveness of this intervention and the pharmacovigilance system. This program of work will provide evidence to facilitate widespread adoption of the improved case management tools and processes for safe and effective radical cure of patients with P-Vivax malaria, both in PNG and throughout other Vivax endemic countries. Lastly, IMR with National Malaria Control Program, provincial health authorities and other partners will conduct monitoring and evaluation of the HMM program that is currently being implemented by the Rotarians Against Malaria. In this work, we will assess the outcome and impact of the program, acceptability and the cost effectiveness of this program. This work will provide the National Department of Health and the Global Fund with the evidence needed to inform decisions on the scale-up of the program and the continued funding support for sustainability of the HMM program in PNG. If the program is found to have a greater positive impact on health and that it is accepted and cost-effective, timely malaria treatment can be brought closer to home and can reach a wider population, hence saving more lives. With that, thank you.